Over the years, I've worked with many people after hip replacements, and one question comes up all the time. Why did my surgeon use a different approach than my friend's surgery? The truth is, not all hip replacements are done the same way, and each approach has its own advantages and precautions. The three most common surgical approaches are the posterior, anterior, and lateral approach. The posterior approach is done from the back of the hip. With this approach, patients are usually told to avoid bending the hip past 90 degrees, avoid turning the toes inward, and avoid crossing their legs. The anterior approach is done from the front of the hip. Because the joint is approached differently, the precautions are different as well. Patients are often told to avoid excessive hip extension, avoid turning the toes too far outward, and avoid aggressive stretching of the hip flexors early on. Then there's the lateral approach, which comes in from the side of the hip. This approach tends to be very stable, but it can sometimes weaken the hip abductor muscles, so patients are often advised to avoid aggressive side leg movements early on in the recovery. Each approach has its own benefits, its own precautions, and its own recovery considerations. That's why two people with hip replacements might receive very different instructions. Recovery isn't just about the surgery, it's about understanding the approach used and training the body to move safely afterward.